I often get asked by people when they're turning 65 if they should enroll in Medicare, even if they're going to continue to work. And it basically comes down to the situation that you're in and the options that you have through your other coverage. Because Medicare A and B would be primary for you if you worked for an employer that had less than 20 employees. In other words, not enrolling in Part A and Part B of Medicare when you turn 65, and if you work for a small employer, you could be penalized when you go later on to enroll in Part A and Part B of Medicare. Now, if you work for a larger employer, an employer that has more than 20 employees, Medicare A and B would be secondary to your employer-sponsored plan. So I often get asked, well, is there a downside to enrolling in A and B of Medicare, even if I'm going to continue to work for an employer that has more than 20 employees, where A and B of Medicare would be my secondary insurer? And there really isn't a disadvantage to enrolling in Part A of Medicare, as it doesn't cost anything, and it's basically a secondary insurance to your employer-sponsored plan. But there is a premium for Part B of Medicare, which is determined on your income, and so the downside might be that you might be paying for more coverage than you actually use, because if your employer-sponsored plan is going to be primary and Medicare is going to be secondary, you may never, take advantage of that premium that you're paying. So in the long run, depending on your situation, you may or may not want to enroll in Medicare. Also, remember that enrollment in Medicare, even with a large employer-sponsored plan, where Medicare would be secondary, enrollment in Medicare, if you are covered under an employer-sponsored plan that is a high-deductible health plan, and you're making health savings account contributions, once you enroll in Medicare, you are no longer able to make HSA contributions under that employer-sponsored plan. So keep that in mind.